In January, Shota Nakahara of Japan, one of the listeners to Voice of Korea, sent us an email which wrote that he is eager to know how doctors treat the patients coming to the hospitals in the Democratic People's Republic of Korea. In order to seek an understanding of many listeners, including Shota Nakahara, we are going to tell you a story told by reporters of the Radio Television Broadcasting Committee of the DPRK, who visited a county hospital for coverage in October last year. One day in April last year, a worker at an ironware factory in Gwal County of South Hwanghae Province was carried to the county hospital as he seriously injured his eye at work. According to the director of the hospital at that time, several retinal parts of the right eye of the patient were torn 1.5 centimeters. Moreover, he might lose the sight of his left eye because of infection in case urgent measures were not taken. Officials of the factory as such have earnestly called for restoring sight to the worker, saying they would donate their ocular conjunctiva if necessary. This is Kim Jong-sim, who was in charge of the patient at that time. It is said that she had long been working as an eye doctor at the county hospital. As a matter of fact, she had no confidence to treat the patient when she saw his state first. But she was moved by the sincerity of the officials who are ready to devote even their own eyes for the sake of a worker without hesitation and value the workers most. Furthermore, the duty of a doctor who should be responsible for the lives of people propelled her to take charge of the patient. An ophthalmic operation was performed at the Gwal County Hospital for 2 hours to restore sight to the patient. The nurses who witnessed the operation said sweats were streaming down the face of Dr. Kim Jong-sim for the 2 hours, and she was so strained that her whole body was wet with sweat when they unclothed her of her surgical robe after the operation. When the reporter praised her for her devoted efforts, Kim Jong-sim said, "When I took charge of the patient, I thought of a public health worker of the former generation who had taken the ocular conjunctiva of the eyes of his wife and little daughter, to say nothing of his, to graft them on a patient's eye. I simply tried to learn after his lofty mental world."
제가 그 병원에 대한 취재 과정에 직접 목격한 한 가지 사실이 있습니다. 이미 병원에서 치료를 받고 퇴원했던 한 여성이 우리가 병원의 의사 선생님들을 취재한다는 소식을 듣고 저를 찾아와 들려준 이야기는 정말 감동적이었습니다.
2 years ago, farmer Rim Myung-bok at the Songgok fruit farm was not well, but she worked hard, thinking that she would go to the hospital after getting through the busy farming season. Unfortunately, however, she fell in a faint. Dr. Kang Song-hun was in charge of the patient and completely recovered her. According to him, as her case was so serious at that time, it was impossible for her to live 3 days more. However, Kang Song-hun and other doctors of the Gwal County Hospital did not give up. They only thought they must save her at any cost. 7 hospital consultations and more than 10 department consultations were held for the patient, and 6 operations performed on her. During the operations, her doctor, Kang Song-hun, grafted more than 60 pieces of his skin on the body of the patient 5 times. The patient stayed in the hospital for treatment for 7 months.
7달이란 전 기간 전체 가해금병원 의사 선생님들과 담당 선생님 다 정말 잊을 수가 없습니다.
Her simple expression represented her gratitude to the socialist system of the Democratic People's Republic of Korea that values the human beings most, as well as her praise for the public health workers in this country who treat the patients with utmost sincerity and high ability. Good health of the Korean people is guaranteed by such laudable public health workers.